Granger, Executive Director of the Children's Advocacy Center, and on behalf of the CAC Advisory Board, the staff, and the Justice Resource Institute, I'd like to thank you all for joining us at the Greater New Bedford Legislative Breakfast. Many of you have been a part of these legislative breakfasts in years past. We used to do one big forum for the entire county. And last year we decided to break it up into 4 smaller regional venues and forums so that we could really show everyone who's in the room the impact that we're having in your community. So thank you again on behalf of the staff who have helped tirelessly gathering data and statistics based on their good work to put this together. I would also like to thank Bill and June Stark of William Stark Architects, and today we have Rodney Jacques with us here today, who has sponsored every legislative breakfast throughout the county. Rodney, my thanks to Stark Architects, a wonderful, wonderful supporter to the CAC. To LaFrance Hospitality and the folks at Waypoint for their accommodations today, we're so grateful. And to the legislative delegation here today that I'm going to recognize, we do this because we want you to know the impact that when we're looking for your advocacy for us at the State House, we want you to know all that we're accomplishing, all that we're looking at on behalf of your constituents. Senator Mark Montigny. Senator Montigny, thank you so much for being here today. Representative Chris Markey from Dartmouth. Rep. Markey. Representative Paul Schmid. Thank you so much. Thank you, Rep. Schmid. And we have Glenda Izaguirre. Thank you, from Congressman Bill Keating's office. Representative Tony Cabral is with us today. I believe we're in your district here. And newly elected State Representative Chris Hendricks. Thank you very much, Rep. Hendricks. And from our local officials, we have City Councilor Hugh Dunn with us here today. Thank you, Hugh. I'd also like to acknowledge our partners that we have been working very closely with in the Greater New Bedford area. Superintendent Tom Anderson. I have gotten to know Superintendent Anderson, a wonderful supporter. Thank you so much. As well as his colleague, Superintendent Bonnie Gifford from Dartmouth. Thank you. We've got Dartmouth and New Bedford represented so well here with Chief Brian Levesque from Dartmouth. Thank you, Chief. And of course, our key partner right here in the city, Chief Joe Cadero. Chief Cadero, where are you? Thank you, Chief. So I wanted to start with just doing an overall total before that we talk about really what's been happening here in the Greater New Bedford area. You often hear me talk about the increases since our inception. 2018, the year that just closed out on June 30th, we realized just a 22% from the previous year. But since our inception, we have seen a 164% increase in the cases served. It's pretty striking. I think that there are a number of factors that contribute to that. I woke up this morning and turned on the television, and the first top 2 stories were about someone who's being arraigned in Nantucket on a sexual assault, as well as a abduction and sexual assault in New Hampshire. Folks, this is a very real issue, and I am proud to say that the Children's Advocacy Center is really working tirelessly to address this, and the point's not lost on any of us here that this is impacting Bristol County, and you'll see also the Greater New Bedford area. This is the breakdown of who's getting the cases. Fall River, Greater Fall River and Greater New Bedford have always been our biggest customers, if you will, and you'll see the breakdown here. About 1/3 of all of the cases are coming from Greater New Bedford. So before we proceed with some other local statistics, I'd like to shine a light a little bit into the work that we're doing and offer my thanks and gratitude to Big Ocean for this amazing piece that they have put together showcasing our work. And if someone could grab the lights in the back, it might be easier to see. Thank you.
Before the age of 18, this is a very, very big issue. We had over 800 referrals here last year. That's just Bristol County. It's not just in our cities, it's in our towns, it's in our suburbs. Sexual violence to children needs to be talked about to address education, to address awareness and prevention, and take away the shame of the topic.
I think you carry it with you for your whole life, and how you manage that and how you take care of yourself and know when to ask for help, I think is really important.
It's a complex issue, but it's all about minimizing trauma for kids who have been through abuse at the hands of someone they know, love, and trust. We're all about empowering victims to know that they're not in this alone, this is not their fault, and that we're going to make the response to their sharing of their abuse as best as we possibly can. We coordinate to make sure that as they have to provide the details of what someone has done to them through the forensic interview, that we have all the right people around the table, law enforcement, the child welfare system, medical care, mental health professionals.
Sometimes you do somewhere no one knows how to handle it without making it feel like it's your fault, because it's never your fault. Without it, I would have to disclose to like so many different agencies, and that would have been detrimental to my health, because I have to do it over and over and over again. So be on the other side of the table and have this team come together. They're all trying to figure out what's the best for this child. It gives me goosebumps actually, because it's like really inspiring.
We see kids at their most vulnerable point. They carry so much shame and guilt around that abuse. They're brave and they're warriors, and when they finally do speak up and have the opportunity to come to a place like the CDC and we can validate that they have been brave and they have been a soldier and that we're going to help them get what they need leaving here, it's amazing to see. For some kids, that may be transformation that happens. They know that we're here for them. We keep our hand on the back of each case for as long as it's needed, so that each child and family has the support they need to get through the entire process. We opened up the HEART program, the Healing and Resiliency program here at the CAC. We now have the wonderful opportunity to engage families when they're here and connect them with clinicians here on site. Being able to provide on-site mental health for these kids and families coming through our doors, it's amazing and it's awesome, and we're so glad to have this opportunity.
I had no idea like how many cases actually come in until I started working here. It definitely gives you an idea of how dense of a problem this is and how important the CAC is. Just so we have that support, so we can have a voice and feel like someone's listening to them and that they can move forward from this terrible thing that happened to them and kind of become like who they want to become.
We treat every single case as if it was our own family member. Mediocrity is unacceptable for any family that comes through the door. We see too much here. We see too much harm to kids and families. And we see the impact that it has. So we've addressed child abuse prevention by developing the education and outreach program for the last 6 years. The challenge is great, and the Children's Advocacy Center impact has been significant, but we can't do it alone. It's not enough, and we need everyone to rally around understanding the scope of the problem and taking action.
It doesn't always have to be a long-term process. Some of the myth was that kids have to be in treatment forever, and they really don't, that they just need to be in the right treatment. It doesn't have to be a life sentence, you know? Lots of people recover, and we get to be a part of that, so it's pretty exciting. You need support, like it's impossible to do it by yourself. I had to figure out like a new dream and a new path. Having the support so that you realize like, you know what, maybe it's not like your original plan, but it's a new plan and it's a good plan. There is hope even through this really terrible thing, but there is a brightness in your future. Don't let this define you. You are way more than what has happened to you.
Thank you again to Big Ocean, who spent some time with us. It's just so rewarding to know that in the last year that we, for the first time, had a survivor on staff with us. Megan is doing amazing and is now working in a full-time position in another JRI program. It's really social justice at its core. We also had another service recipient that has been through the agency come back and do a 30-hour internship. And we're really, really proud of the fact that we've reached the longevity point in our time where those that have benefited from our services are coming back to learn more about how to do the work with others. It's really wonderful. So let's talk about what's happening here in New Bedford. Just an overview of our direct services, what we're doing about capacity building, education and outreach, and our role as an information clearinghouse here. So in this information reflects fiscal year 2018. For those that were with us last year, because it was the first time that we did a regional breakout, I gave a picture of the 11 years of data that impacted Greater New Bedford, but thought that it would be important to just reflect on the last fiscal year. And in some of the information, we'll also talk about what we've seen in the first 6 months of fiscal year 19. I want to spend some time talking a little bit about this statistic here and show that when you take time and investment into education and awareness, that your numbers are going to go up. And that's typical with any education and prevention initiative, is that if you're doing it well and you're doing it right, your numbers are going to go up. And it's unclear when you're going to hit the top of that bell-shaped curve so that the prevention as a result of the awareness and education comes down. But I want to spend some time talking about commercial sexual exploitation of children or child trafficking, to which Senator Montigny is amongst us, and this has been a key issue in his work up in Boston. And I can tell you, Senator Montigny, it's wonderful, but our work is clearly not done, particularly here in the Greater New Bedford area. This is who's referring cases to us. This looks pretty different in fiscal year 18 than it did in the previous 10 years around who our referral base is. But again, I'm going to keep going back to the fact that there's been some significant changes in DCF policy around this population, as well as the CAC's response and case management and intervention with these cases. It used to be pretty split between the law enforcement referrals and the DCF referrals. referrals. We generally will get referrals from law enforcement for those cases that are what are referred to as a DCF screen-out, so it doesn't fall within their regulatory purview of caretaker. So this is non-caretaker, but a crime may still have been committed, and children need a coordinated investigation, and that's why law enforcement or the district attorney's office would send a case to the CAC to coordinate it and have us be as a convener for that child. So some differences in just fiscal year 18. Who's being harmed by violence, be it physical abuse, sexual abuse, and those who witness to violence? And many of you have heard me say, and we saw an uptick about this, reminding folks, while sexual abuse tends to be the primary reason while we're coordinating the response for a coordinated investigative response at the entry, as well as all the other services that we provide with family advocacy and case management, as well as now on-site mental health. Physical abuse, and I always say, if law enforcement needs to talk to a child, either as a witness or as a victim of physical abuse, as well as DCF, those cases should be coming to the CAC for a coordinated response. And so we did have an uptick in fiscal year 18 of the physical abuse cases that we were seeing, but that ebbs and flows. And this is the age demographic of what we're seeing, and I'd like to focus a little bit about this 0 to 17. Again, you heard me talk about the issues of youth offending on other youth and some of the challenges in this work that we're doing, but this is the age demographic of victims. You'll see here, this is the Disabled Persons Protection Commission, so DPPC. So those are adults with intellectual disabilities that otherwise have cognitive functioning like that of a child and benefit from a coordinated, developmentally sound response system. Every chance I have, we talk about the different types of justice that victims may seek in their work. And one of the focuses that the Children's Advocacy Center has is on procedural justice. How we treat people, particularly victims of a sex crime, matters. And I often talk with our partners that are doing this work that because it's so labor intensive and because it is so challenging, that for us to remember that very, very few of these cases get to criminal prosecution. Criminal justice is only one part, but how we treat people and how we share information with them and how we tell them, how we believe them, and that we support them matters. It has a huge impact on how healing happens. So I didn't want to miss the opportunity to remind everyone around procedural justice, because no matter what happens with it in all the other types of social justice arenas, how we treat people matters. This is who we know based on the cases coming to the CAC around who is identified as harming them. So if you can see here, we've got parent, step-parent, and parent's partner. And it's really interesting that there's some myths, and we spend a lot of time trying to train on the myths and the misnomers around what we know. Everyone wants to believe that it's mother's boyfriend, right? That it's the mother's boyfriend who's sexually abusing a non-related partner. You can see here in the greater New Bedford area that's 8%. The other relative, these are cousins, uncles, and grandparents here, but this other known person, this is usually a family friend. This is friend of the grandparents, friend of the family. So it's someone that is known, loved, and trusted by the family, which causes some really interesting dynamics when child abuse is reported. And again, this unknown will speak to what we're going to talk about a little bit more around the commercial sexual exploitation of children and identified abusers in those types of cases. What you saw was 19% of the total cases in fiscal year 18. Last thing I wanted to share with you that also speaks to is the case of the offender's age. So those that are harming and identified as perpetrators, as we call them, the age demographic that you see here, this is again based on fiscal year 18 information. 15% identified as aggressors in cases 0 to 11. We're going to talk a little bit more about that. 12 to 14, 15 to 17. So these are all considered minors. These are all considered minors. And then the 18 to 25 and the 26. The numbers of kids aggressing on other kids is pretty striking. So last year, there was some wonderful legislation passed in the Juvenile Justice Reform Bill. But what we've found at the Children's Advocacy Center is that now that you cannot have a level of accountability for kids under the age of 12 who are engaging in sexual aggressing, which ranges from fondling up to aggravated and forcible rape, that those are no longer cases that are going to be handled in the criminal justice system. And whether you have a thought or an opinion about those are the places for it or not, what we care about is what goes missing for victims. As a victim-serving agency, we did an evaluation, and over the 12 years of data, we've had over 350, and you saw the percentage of kids from 0 to 11 just in fiscal year 18 that are identified as sexual aggressing. Again, not the thought that they should be prosecuted. That's clearly not the answer. These are kids that sorely need treatment, and we know statistically that and research will tell us that kids who are sexual aggressing, that if they're not referred to the right treatment or immediate treatment, that their chances of reoffending is significant. But what's happening now is that these kids, not only are the victims not having an opportunity to have a coordinated investigation because there's no criminal findings. The system, and it's usually non-caretaker abuse, so that there is an opportunity for DCF in their decision-making, but in keeping with their regulations, to not serve this population of kid-on-kid abuse, which have been most typically screen-outs for law enforcement to do the coordinated investigation. These cases are going nowhere. Nothing's happening with these cases. So what the CAC has started doing is offering the opportunity for the parents of the victim that has been aggressed against to call the center so that we could do an assessment of what is happening. Because we're a victim-serving agency, what goes missing is those kids under the age of 12 who are identified as aggressors, and what's happening with them is the question I'm asking, and that we're concerned about. So I share that with all of you of opportunities for discussion moving forward. Any questions on that so far? I don't want to keep talking at folks and just, but I didn't know if anyone had any thoughts or comments about that. Sure.
I was just wondering, so how do you find out about those kids that are victimized under the age of 12? How do you know?
So the question is, how do we find out about that under the age of 12 population? So we have professional advisory committee meetings with our partners, forums like today. This is something that has been identified probably in the last 6 months due to the new legislation that was passed. There's not a consistent forum. How do we identify them? The Children's Advocacy Center is a service delivery agency that says, how do we get to yes? And by law enforcement or DCF, if the parent happens to know that a 51A was filed and people referring them to us, there's not a mechanism in place right now other than what I would say is by happenstance. But because we're starting to talk about it and because we're starting to identify and address this gap, we're getting more and more phone calls. Capacity may be an issue at a time. Right now it's not, even though we've had a 22% increase in the number of cases we're serving. We can't sleep at night knowing that there's someone that needs help that needs to be responded to. Any other thoughts or questions? All right. I'm going to invite Jessica to come up here. Jessica is our CSEC coordinator. I've been asked to have folks come to the podium because they're recording here. So Jessica is our CSEC manager. You'll see in spring of 2017, Jessica was hired in a full-time position to address the child trafficking that's happening. And I'm going to let her talk a little bit more about how we're better defining that for you all.
Hello, everybody.
So you got to talk right into it.
So these are our CSEC numbers. As you can see, in 2016, we had about 9 cases. This was when we first really started identifying CSEC cases in Bristol County because our protocol had just been really developed. In fiscal year 2017, you'll notice that those numbers go up a little bit to 32. That in fiscal year 2018, we had about 106 cases, so that's kind of a huge spike. And as we're seeing now, in only the half, so we've been through 6 months of fiscal year 2019, and we're already above halfway of last year. So we can really see our numbers are significantly growing. I would say this is really done because of all the education and outreach that's been done in our communities. From the CAC and other organizations, people are really starting to get aware of the issue and know how to identify it.
This is agency-wide, this is county-wide data. This is not New Bedford specific. You'll see that next.
So in New Bedford, so this is just fiscal year 2018 and the first 6 months of fiscal year 2019. So in New Bedford, you'll see a total of 42 cases. So it's broken down into different things because CSEC can be a couple of different things. So CSEC could be child trafficking, so when we think about a child being bought and sold for sex. It could be peer-to-peer sexting, so technically child pornography is considered a form of child trafficking. So when we see peer-to-peer sexting, this could be 2 16-year-olds exchanging images back and forth. And then the adult to child pornography would be when we have a perpetrator over the age of 18 who is getting images from a child. So you'll see the child trafficking cases are still almost half, or are half of the total cases. And then in fiscal year 2019, you see 47 cases total. Now, just referring back to this number, so in fiscal year 2019, so the first 6 months, we saw 73 cases. So 47 of those came from New Bedford. That's a huge number that we're dealing with out of our New Bedford area. And you'll see 35 of those cases are child trafficking cases. So there was concerns that a child was being bought or sold for sex.
Oh, that's great. Okay. Thanks, Jessica. This is a classic example of education and awareness. In 2015, the state of Massachusetts, from my brilliant colleague in Suffolk County, put together and got a federal HHS grant for a 5-year rollout across the Commonwealth. Bristol County was the second county to get this amazing training on how to pull together a multidisciplinary team to address just child trafficking. And you'll hear, so the state law is commercial sexual exploitation of children, or CSEC, but federal laws use the terminology child trafficking, and for name recognition, I would say child trafficking. But in the CSEC legislation, because child pornography is one of the elements in the legislation, thank you, Senator Montigny, brilliant. So part of it is that we wanted to be really clear what we're dealing with. Kids that are being bought and sold. We've worked closely with our colleagues in Dartmouth and some of the issues with the Capri Motel, any areas where there's hotels and motels. This issue looks really different now than it did 20 years ago with places like Backpage, which has since been taken down, thank God. Good for the Congress people who were able to address taking down the location where kids could be bought and sold, but also wanted to be really clear about how we're understanding what we're dealing with. Child pornography is illegal, and we certainly need to have some opportunity, but how we respond as a center and how we respond as a multidisciplinary team and how we identify some of the challenges like dumping phones and getting the technology where this exchange of pornography is happening. It looks a little different than kids who are chronically on the run, showing up with items that give us really high-risk indicators that they're being trafficked by pimps.
Of those cases, Michelle, do you track how many actually resulted in the arrest of the trafficker and how many are in jail or prison sentences?
So we could do a legislative breakfast on that issue unto itself. If we thought child sexual abuse was a complicated issue, how to respond to child trafficking with the needed training for law enforcement. So identification is so much better, but how to think about it from beat officers in uniform patrol knowing what to look for someone who's a chronic runaway, to a detective, to working with prosecution. We're talking about that on a statewide level because I will tell you that arrests are very, very low. And we know a lot about this population, right? When we first come upon them, they're not usually very willing because of fear to come forward. So this issue, you want to talk about taking the time to keep our hands on the back of kids until they're ready to come out of the life and talk about their exploitation. These are not one and done cases. These are cases that you have to keep your hand on the back. And I'm not convinced that the system is built for that slow and steady wins the race until you address needing to stay connected with this victim who is going to be in and out of the life for a very long time until they're ready to talk about how they've been exploited. And that's one of the challenges in these cases, is that I think we, in the volume and pace that we all deal with, and I think that's the beautiful thing about Jessica's role, is that we can at least keep our hand on the back of that case and try to support those agencies with investigative responsibilities, law enforcement, DCF, who've got 85 gazillion more cases coming across their desk to see what's happening with those cases. There has been some amazing work that has happened on behalf of these cases. The state police has identified a high-risk unit that can work with local law enforcement, so we're working on getting that out because resources, it's a resources. But I will tell you that the arrests and the prosecution is very, very low compared to what we are now just learning to identify.
I mean, you all need to really spotlight that issue because there's still, I mean, the paradigm has shifted somewhat, certainly since I was involved a decade ago.
Yep.
Your runaways, they're delinquents, it's so sad, but
Yeah, they're victims.
Or they're a prostitute who made poor choices. No, there's very likely an addiction problem with the adult and a complete rape and child abuse problem with the child, yet we're not putting people in jail for rape and trafficking in human beings, which could result in an underage person in a life sentence.
Right.
I'm going to celebrate the first time somebody goes to jail for life.
Right.
But it isn't happening.
The Stockholm Syndrome concept with this population also is very real, which is why it takes time for them to realize that they're victims and that to get out of the life. So thank you for your work on this. We're in this together with our colleagues in law enforcement. We don't have it all figured out, but I think it's really important for us to reflect on this data to understand kind of where we've been and where we're going with this. DCF has done some amazing work changing their intake policy that when a 51A, so first of all, CSEC is now a mandated reporting category, beautiful. It is seen as a child abuse issue. It's an automatic screen-in for the Department of Children and Families by policy change, which is an automatic multidisciplinary team response. I really feel like DCF and particularly Bristol County, that we've done an amazing job at getting so much better at that. But then what happens next? Where is the service and population? You know, where is this population being? Do they need specialty services? Those types of things we're still grappling with. I'm going to also ask Kathy, our Director of Victim Services, if she could come and speak a little bit about our clinical service delivery.
Thank you. Good morning. Very excited that this past July we were awarded some VOCA funding in which allowed us to look at some areas of need both in the community and at the CAC, and we were able to do some expansion around clinical and mental health services, which allowed for us to hire 2 full-time mental health clinicians, Brittany Morose and Jillian Allen, who you may have met here today. We were able to send both Brittany and Jillian, myself and Jess, down to Yale University to be trained in CFTSI, which is Child and Family Traumatic Stress Intervention. It's a short-term treatment intervention for kids who are experiencing trauma, so it's a nice fit in the work that we're doing at the CAC, getting kids connected right away is really, really important. And we know that mental health services here in Bristol County, it's hard to get kids into treatment right away. So we have a little bit of a caveat, and I'm very blessed and grateful for that opportunity. Just in the last 5 months, we've been able to serve about 29 families, and we're getting busy. We're not as busy as we should be, but we will get there. And I anticipate that at some point very soon we'll be looking to hire more clinicians, which is a really good thing. So, does anybody have any questions about our clinical services? Okay, that's great.
We're really proud of this, and I would like to do a shout out to Congressman Keating. I think the Victim of Crime Act funding has been instrumental in victim services being enhanced across the country, and to the agency that manages the distribution of funds, the Mass Office of Victim Assistance and Liam Lowney. But it starts because Congress has released more money in the Victims of Crime Act funding, and that has been instrumental in our being able to do more to meet the needs of victims, especially around their treatment. So the Children's Advocacy Center has been talking about the Adverse Childhood Experiences study since our inception. I give credit to our very first PD SANE nurse, Ann Marchant, who had an incredible passion and focus for mental health treatment and making sure that we get it right for kids because of what we know the implications are. I'm not going to spend a lot of time. For those who don't know about the Adverse Childhood Experiences study, you can Google it, but it basically is the impact of trauma over the lifespan without connection to appropriate evidence-based mental health and the adoption of at-risk behaviors and the physiological impact over the lifespan. It's got to be one of the most profound pieces of research that's been done with working class people. This was done by Kaiser Permanente on the West Coast, and the survey sample is either 14,000 or 17,000 adults who identified their victimization of traumatic childhood events, and that all of they were being monitored because of the physiological impact of the trauma over the lifespan. It's just such a profound piece of research that clearly tells us that we either pay now or we're going to pay later, and we're going to pay exponentially later when you are dealing with disease and disability and maladaptive behaviors. You heard in the video that really when you keep seeing your numbers go up every single year exponentially, that the need to identify prevention is key. We really have to talk about how to stop this from happening and stop adverse childhood experiences from happening. These are the different types of trainings that we offer. This is everything that we have offered. Our menu of trainings is on our website as well, and we offer trainings to professionals on recognizing and reporting and the best practice response for a disclosure of abuse, to a number of child and parental caregiver trainings. And we do a lot of tabling and outreach. And you will see a newly developed prevention brochure on your tables. Again, everything that you see on the table for prevention is developed by CAC staff based on feedback from parents, from caregivers, from students, from data that we receive, some national research. I am happy to say that we've worked really closely with Dartmouth schools, and Superintendent Anderson and I have met a couple of times, and we've done a training for every building principal in New Bedford schools, and are going Stephanie and Andrea. Okay, Stephanie and Andrea, who are the two education, thank you, Andrea. Last year, we were able to increase and have Andrea join the education and outreach team based on the wonderful opportunity that we were the grant recipient for the, from Blue Cross Blue Shield, and I can't believe I'm forgetting Nick. Littlefield. Thank you, Nick Littlefield Award, and so that we have 2 years of funding for Andrea to assist with this. And I also would be remiss if I didn't talk about the fact that for the last 8 years, Bristol County Savings Bank has been instrumental in keeping our prevention activities happening. I want folks to know that we want to share with both our public and private supporters all that we're accomplishing with your support. So this is a breakdown, and I show this because we have work to do, right? So we need to continue to get to schools, we need to get to parents, we need to be able to table and share prevention. The prevention brochure, there's a RAC card there. We're identifying and developing materials so that if it's getting in the hands of parents, we also have Spanish and Portuguese available for our prevention work. But don't take it from me. Don't take the feedback from me. Let's take it from those who are getting the trainings, right? So we just picked out the overall. These are two. We do evaluations on all of our trainings. So Stephanie and Andrea and Jess in the community talking about CSEC or any of our trainings. I just want to read, this is what some of the professionals are saying. Excellent presenter, very informative. Her presentation should be mandated to every person or agency working with children. Very useful information. I would have loved to have had more time to learn information. She had an answer for every question. Thank you. I'm going to tell you that in the 10 questions that we asked, the thing where we get dinged the most is that not enough time was allotted for the training. And we're kind of backed into it based on what systems allow for. And I've said this to Superintendent Anderson, if we have to go to every single school in New Bedford to accommodate their schedules, we get it. We get the time on learning. We understand that there are competing demands, you know, MCAS, we get it. We will be the nimble people that will figure out how to get the people the information they need, because things like, in my 32 years of teaching, this is the only training I've ever had on this. Why? Now, I'm going to tell you that I guarantee you that this person's had mandated reporting training. Someone can go online and take a 30-minute mandated reporting training, and they will have satisfied checking off the box. But they are not going to get the training that we can do in about an hour and a half that talks about myths and misnomers, the issues that are cropping up in today's day and age around minimal facts interviewing, issues of taint and overzealously interviewing of kids, and a lot of other really important factors related to being in a youth-serving organization and how do you respond. I always say to teachers, they went to school to learn how to align their lesson plan to curriculum frameworks and help achieve those academic metrics. It's not their average day when someone tells them that they can't go home because their uncle is sexually abusing them. We want to give them the tools that they need to be as best they can be to respond to that disclosure, just as much as they are being able to write their lesson plan. So again, this is some, sure.
When it comes to mandated reporters training, any training done with religious organizations?
If they'll have us, you would be amazed at how hard it is for us to offer free training to people. So this is why we do these things, because I'll tell you, we need ambassadors. Hey, call the CAC, get them in there, because they don't necessarily listen to us, but I guarantee you they'll listen to you.
Okay, I'm mandated reporters in Massachusetts in 2002.
Right.
I know that. I wrote the legislation.
Yes.
The House and the Senate. Not only clergy people, but anyone who works for a religious organization.
Yes.
Regardless of denomination, regardless of what kind of religion it is. So I'm surprised not to see the numbers related to religious organizations.
We will offer training to anyone who will listen. We know how important this issue is around making sure that if a child is being harmed, that it gets in the hands of someone with investigative responsibilities. But I'll tell you that there's mandated reporting training, and then there's the CAC training about recognizing and reporting that covers not only the law, Chapter 119, but goes really into best practices and really equips folks with understanding why a minimal facts interview is best practice, why they should let DCF and law enforcement take care of doing the investigative pieces, but how to, in a best practice way, put that information in the hands of those agencies with investigative responsibilities.
So basically, you're being rather diplomatic, you're saying no training in any kind of religious organization.
Steph, you could,
I visited a couple of private schools that were Christian. I think 2 that come to mind, but nothing for, say, people teaching Sunday school or things of that nature. We don't have those connections yet, but we want to make them.
There's Anchor Ministries that is part of the Erase Coalition
Yep.
in our county. And that's specifically for the commercial sexual exploitation of children, but we've done trainings with them and they've helped promote us in the community as well. Not so much for the mandated reporting piece, CSEC is a part of that, but more so CSEC specific trainings. We've had help from like religious organizations like that.
I've been in contact with Catholic Social Services to offer our services, and so it's a process. I always joke and say getting the training, the CAC training in, is like the marketing. It takes someone hearing it 6 times before they'll adopt it. That's applies here as well. Just wanted to share with you some of the work that we're doing as a small organization with interns and volunteers. We're going to be really busy getting the assistance from and working with folks. We come starting in the next couple of weeks. We've got a BCC student, Roger Williams student, who's going to be with us for 1.5 years, which is really cool when you can have that longevity. We had an intern from the criminal justice program for 30 hours from Fitchburg State, a psychology major from the University of Massachusetts is going to be with us a lot of hours over the course of the summer and continuing next year. And then we are also going to be doing a 30-hour shadowing and assistance with the education and outreach program with the Atlantis Charter School. So our use of volunteers and interns, I just wanted to share with folks, is quite alive and well. It's important for us at the CAC, and now that we're a program of JRI, to talk a lot about kind of our evolution in service delivery, our evolution in staff, that we have really, everyone's heard me say this, I don't recommend opening a small grassroots nonprofit 18 months before the worst economic downturn. That's material for a book, but we are here, alive and well, and at a position of time where we were really in a position of strength, addressed our need for long-term sustainability and joining the most amazing organization, the Justice Resource Institute, which has a footprint in Massachusetts, Rhode Island, and Connecticut, and is really a leader in social justice, as their mission says. But we as a program of JRI, our funding needs don't change. They're not our white knight, never have been, never will be. We've got a 22% increase in cases just from last year, and we will be seeking, we're running a deficit budget. We need supplemental funding in fiscal year 19 and need our state funding to be in keeping with our service delivery expansion, our responsiveness, and we are continuing to talk about how not to do this from annual supplemental funding for this child welfare, public safety, public health work. That is what the Children's Advocacy Center is doing. So we're in very preliminary talks with EOHHS around contracted funding. This is the breakdown of how our funding plays itself out. And so I share this because I've always said that this is a public-private partnership. That will never change, but as the needs increase, and whether you're a private supporter and donor or a public advocate, it's really important for us to know where our funding comes and how everyone is doing their part to help keep the Children's Advocacy Center sustained. Just wanted to highlight, we're now 18 months into our relationship with the Justice Resource Institute as a program, And I like to brag. I like to brag about what the CAC is doing because we're working hard, but I like to brag about this amazing agency that we have joined. And there's a poster there around the various programs that JRI runs in addition to the Children's Advocacy Center. But JRI is so much more than just a leader in social justice, and one of the reasons why the Children's Advocacy Center is now a program of JRI, not only around the mission alignment, but the efficiencies and the ability for us to actually have things like benefits. As many of you have heard me say before, if you wanted to work at the Children's Advocacy Center some 3 years ago, you had to have a spouse or a parent that had health insurance. We fixed that. Staff retention and quality and scope of staff clearly gets addressed with things like that. But we have access to other initiatives at JRI, and the staff at the CAC get to participate in amazing programs, like a program called Futures, where JRI brings in a cohort of staff from across the entire agency to talk about a career within JRI, because it's so big, it's so robust, and there's so much opportunity within the Justice Resource Institute. And this point isn't lost on me, that as we send CAC staff to these cohorts in leadership and participating in other things, that this means that someday the CAC staff will go make their mark in another JRI program. And while you hate to see staff, what a wonderful, wonderful opportunity for folks to be able to expand and spread their wings. They have clinical supervision programs, psychological first aid, have developed a trauma response network. You saw the picture at the beginning that we went and did some team building on a ropes course on one of their programs. A diversity advisory committee, substance use task force, family advisory committee, immigration task force. I just wanted to highlight a little bit of what's happening within this agency that we are a part of, and that we now have access to for the last 18 months and going forward. So what's in the queue? When you grow like we do, we are busting at the seams. In my office, where I used to sit and had 11 years worth of paperwork, is now housing 4 staff. So we threw some cubicles up. We're busting at the seams. We're in a feasibility study to explore additional and/or new space for the CAC. Many of you are a part of our drug endangered children training that we just did at the beginning of December and got amazing feedback and received. Thank you to the Carney Family Foundation, who not only is supporting our work as a regional coordinator and convener on drug endangered children, but is also responsible for that Save the Date that's on your table for a very important forum that's coming up in April. If you have children and if you work with children, that probably covers just about anyone, or if you have access to children, you should come to this forum. We're going to do it just like we did the Corey Jewel Jensen presentations a few years back. We'll do a morning session, an afternoon session, and then we're doing one for parents at night that will include babysitting. We're really proud of the partnership that we have with the New Bedford schools. Jess and the team are able to do commercial sexual exploitation prevention. There's a really awesome video curriculum called I Am Little Red. It's an animation. It's targeted at middle school and high school students around prevention of exploitation. Based on the building of our education and outreach department with Stephanie and Andrea, we are really working on our prevention expansion and working on prevention public service announcements. We want to reach kids using the forums in which that they're linked to, which is this, right? So Snapchat, YouTube, and all of those, get some prevention messaging out to folks around issues from prevention and body safety to consent, and talking to kids around empowering them around issues of consent. And we're in the talking phases of really wanting to put together a teen and youth leadership task force for the to talk about, they're the ones that are going to tell us what we need to be telling kids. We want that information to come from them. And we just received some funding to bring forth the journaling groups in the vision board process. Just got some save the date stuff. You can cue up the next thing. So here's some things that are happening. one of which is on your table. But so for my law enforcement colleagues, last Thursday is that big hot wing eating contest. I have to do a shout out to Dartmouth PD, who is the reigning champion. It's actually, our first year we did it, it was a Acushnet. Greater New Bedford's got the trophy coveted down here. Acushnet PD was the first year winner and Dartmouth PD was this year. So get your sound wing eating teams together. It's just a quick video.
The ripple effect of our actions or inaction can be enormous, spanning generations. Perhaps the greatest tragedy of this nightmare is that it could have been avoided. Predators thrive in silence. It is all too common for people to choose to not get involved. Whether you act or do nothing, you are shaping the world that we live in, impacting others. All we needed was one adult to have the integrity to stand between us and Larry Nassar. If just one adult had listened, believed, and acted, the people standing before you on this stage would have never met him.
Pretty powerful statements from a survivor. And so we use this as a call to action for all of you here with us today to take action, believe, advocate, invest in best practices, commit to trainings, and please support us in the work that we do to help all victims and survivors of any type of violence. We care a lot about kids and we need your help. I want to thank you all so much for your time and your presence here today, to all our partners. I look forward to coming back here every single year and updating you on all of the work and all of your impact on helping us do what kids and families throughout Greater New Bedford need. So thank you so much for your gift of time and Happy New Year.